Glad to be here today. I bring you some quick good news and a little bit of forecasting so that we can go forward and go into the next few months with some information in terms of what's going on. So I'd like to start with my first slide showing where we are nationally. You can see that our peak has continued to go straight up, but now we're coming down a little bit. The deaths there for the last 30 days are still up, but we're seeing progress. And as you can see, the trend line for the cases is pretty much flat as opposed to going straight up the way it was before. So that's all good news. Likewise, I'm going to show you then what we look like now in the country. And you can see that there's actually some spots where the cases have actually gone down. We continue to have the same four colors: high, substantial, moderate, and low. So you actually can see some spots where it's gotten down to moderate and low as opposed to being all red. In terms of what's causing this, it continues to be the Delta. We're now at 99.1% of all the cases, of all the variants, continues to be the Delta. On August 30th, the Mu variant was classified as a variant of interest by the World Health Organization, but the CDC has not escalated this to a variant of interest in the United States. The variant reached a peak in late June with about 5% of the circulating variants, but it has since gone down, and right now it's down at less than 1%. It's actually 0.1%. So we're going to keep an eye on it, but it's not a concern right now. The Delta continues to be the predominant. It's the one that's causing the cases, and it's the one that's causing more positivity. So with that, we see that our numbers here in Palm Beach County have actually gone down. Our daily positivity for Palm Beach County on the red on top is 11.6, significantly down from the previous weeks. Florida is at 13.5. And as far as the cumulative data, our total positivity is at 19.4. That has remained high, but definitely still going up a little bit. But Florida is at 21.1. So we're hanging in there, and most importantly, our number of cases for the week is only 5,548, which is a lot less. We were very close to 9,000 cases per week. So now we're down to 5,000. That's a significant decrease. So that's why you see the curve over here on the right-hand side with that number going down. Here's where we were at 9,000, and we're down to this number now, which is much more manageable. So with that being said, what we predict is that this will continue to go down a little bit more, and then as we get into the holidays, the travel, Thanksgiving, the holidays, and New Year's, that we'll see that spike that we saw in January to go up again. So we have to be ready. We can't let our guard down. In terms of our census tracts that we're seeing, this is where we were last time that we presented. You can see this was very dark. We even had to add 2 new numbers for the increases here. But now we see that has come down. The colors look lighter, and it's consistent with what we're seeing in the decrease in the numbers. I decided to bring these 2 graphs because people keep saying that we're not reporting our data. It is showing up at the CDC website on a weekly basis. If you go, again, I've mentioned this many times, cdc.gov COVID tracker puts you right on this page, and you can go to the community level and look up Palm Beach County. It shows you the 7-day moving averages for your positivity, as well as the number of tests that we performed. And you can see our number of tests have gone up, and then they came back down here. And our positivity, as we're saying, for the last 7 days has gone down, the total positivity and the daily positivities. The other chart that's there right beneath it shows us our cases and our deaths. Again, reports that we're not reporting our deaths, well, we are, and they're going to the CDC, and so that's where you can see them on a weekly basis. So you can see here that our total deaths in the last 7 days did go up, and now they're coming down, but for some reason this graph got cut off there, so you can't see the downward, but it's gone down in the last 7 days. And our total number of cases consistent with the graph that I showed you before, so those look the same. This is very important. This is our vaccination, and we attribute most of the numbers going down to the fact that we're getting this up. We've gone up by 12% since the July, and so all the efforts that we're doing in terms of getting this done is very important. What you see here is that for the 12 to 19-year-olds, we made this graph specifically so we could track the school-age kids, the 12 to 19, and you can see they've gone above 50%. So that's very good. That's the efforts that are being done, especially with the healthcare district going out and vaccinating at the schools, and all summer they spent vaccinating. They're going back to the schools now, different schools at a time, and vaccinating people there. So we've gotten a good uptake on that, and that allows us to see this number going up. What we have to do is to continue to get this group, starting with the yellow line, which is the 40 to 49, the gray line, the 30 to 39, and then this orange line, the 20 to 29. We got to get this whole group of 4 lines to go up here to the 70%. Because when we talk about the total vaccinated being at 72%, that's great, but that means that includes only 62% that have been fully vaccinated, both doses. And then there's ones that still have only 1 dose. So what we got to do is get this group up here at the 70%, because this is inflated by the group of especially the 70 to 79, which are way above 90%, as well as the 60 to 69 that are at 90%. So that inflates these numbers going up. The elderly, the plus 80, remain just under 80%. And so those are some of the people that we're still seeing, especially some of this group that have underlying conditions from nursing homes and so forth, going to the hospital and having problems as well as dying. So very important that we continue to work on these younger age to get those people vaccinated. And by the way, talking about that, there are lots of parents that want to get their kids vaccinated, especially those that are under 12 years of age. Some physicians are going ahead and vaccinating the kids off with the Pfizer vaccine off-label. The FDA has warned parents who desperately want to do this not to do it until the studies are completed and or if they're part of a controlled study that's going on. We really want them to have that emergency authorization and not just do it on their own until the studies are finished. So again, I want to give the thanks to the healthcare district for doing such a good job of going on and especially vaccinating these younger kids. It's been very successful. I also wanted to give you some very good information in terms of the monoclonal therapy that we've been doing. We've got our site. We get a report each week showing the numbers that we've done. This is the Westgate Park Recreation Center. It was started on August 19th. Our highest number in one day was 1,354. That was the last week of August 30th through September 5th. And our total number is 4,092 with the last report. This one says 4,053, so we've had a few more since then. Our numbers have decreased in the past few weeks, so we're down to about 150 per day. But the people are going there, and this is for people who become positive, have a positive COVID test, but are not sick enough to go to the hospital yet. They might have just some symptoms. They need to go right away and get the monoclonal therapy. Those are man-made antibodies that are infused into your body, either through an IV or they can do it under the skin. They put 2 on the abdomen and 2 on the upper arms, and that allows your body then to fight off and you don't end up in the hospital. So this is specifically for people who are at high risk and have possibilities of going into the hospital. And so those individuals can actually get treated and recuperate much faster, not end up in the hospital. So for anybody in those conditions, that's available. It is free. If you don't have a physician, they will do the prescription for you there if you qualify. And of course, if you have a physician, your physician can send you. This has alleviated the ER, because the ERs were having to do that in the ER for clients that were coming into the hospital. So this has alleviated some of that work that the hospitals were doing. So it's very important, and I want everybody to be aware that it's available. So we need to continue all our mitigation strategies to stop the spread of the COVID. The Delta remains spreading it across the United States and certainly in our community, being very contagious and causing those breakthrough cases. The vaccinations remain the most important tool to stop the spread and save lives. The vaccines are working against all the variants and especially against the Delta. So even if it breaks through, people are not going to the hospital and they're not dying. That's the purpose of the vaccine. So the hospitalizations have decreased, but and you'll see the charts that Mary will give to you, but they're still at a critical mass in terms of capacity, mostly because of staffing. So it's very important that we continue to support the hospitals and continue to get vaccinated so many people aren't ending up sick. We need to prepare then for another surge with the holidays and winter approaching. And I encourage everybody that's listening, please get vaccinated if you haven't done so, not only to protect yourself, but your family and all our community. So with that, I'll pass it on to Mary.
Very good. Thank you, Dr. Alonso. And just a reminder to members of the public, if you have a cell phone or other device, please silence it so that it doesn't interrupt the proceedings. Mary?
Great. Thank you, Mayor, Vice Mayor, Commissioners, Administrator Baker. I'm going to present to you our COVID rephase program right now. And we'll begin with testing positivity. The upper right graph that's shown here shows the overall positivity rate, which has been increasing for the previous 9 weeks. Currently, the overall positivity rate is at 19.4%. At this time last year, our overall positivity rate was 12.79%. The lower left-hand graph indicates the positivity rate over the last 10 weeks of doing testing. But when it comes to the daily lab positivity rate, the graph in the upper right shows the daily lab positivity rate since last July. The lower left-hand graph shows our daily lab positivity rate, which has dropped now for the 3rd straight week in a row. This week we're averaging, as Dr. Alonso said, 11.6%, which is above our target of 5%. The daily lab positivity rate has been above 5% since July 13th. As it relates to the COVID deaths, although the last 4 weeks have shown an increase in the number of reported deaths, the graph in the upper right-hand corner shows that our overall COVID-related deaths have remained stable. The death rate currently stands at 2.12%. As it relates to med alerts, this is a representative countywide sample from Palm Beach County Fire Rescue. We can see by the chart in the lower left-hand corner that med alerts have decreased for the past 4 weeks. This past week, the average was more than 15 patients a day. This is down from the all-time high back on August 14th, where they were transporting approximately 33 patients a day. Now I want to share with you a little bit of information on the hospital reporting. As you know, on August 20th, Administrator Baker signed Emergency Directive 2021A, requiring each hospital in the county to report specific data elements each day by 11 a.m. Today, I will be sharing a few of these data sets. In order to maintain consistency in the report today, the information shown today reflects only the dates when all of the hospitals reported. So this will represent 13 of the 23 days since the directive was implemented. This first graph shows the number of new COVID-positive patients admitted each day compared to the COVID-positive patients discharged each day. You will notice the red line represents COVID patient admissions, and the green line represents COVID patient discharges. The next graph represents the number of staffed beds each day compared to the daily bed census. You will notice the red bar represents bed census and the blue bar represents staffed beds planned for any given day. This next graph represents the number of COVID-positive patients admitted each day who are vaccinated compared to the number of admissions who are not vaccinated. You will notice the red bar represents unvaccinated patients and the blue bar represents admissions of patients who are fully vaccinated. As it relates to ICU use of adults, this graph represents the number of adult ICU beds in use. You will notice the blue bar represents the total of number of adult ICU beds in use each day, and the red bar represents COVID-positive adult patients who are in the ICU. As it relates to ventilator use, this graph represents the number of ventilators available, ventilators in use, and ventilators in use with COVID-positive patients. You will notice the green bar represents the total number of ventilators in inventory each day. The blue bar represents the total number of ventilators in use, and the red bar represents COVID-positive patients who are on a ventilator. As we continue to monitor our countywide positivity rate and hospital surge, we need to keep encouraging residents to get vaccinated. Our Public Affairs Department continues to maintain a list of resources on our county website where our residents can go for vaccines. In addition to vaccines, we're encouraging residents to get vaccinated. With the increased demand for individuals getting tested, we continue to maintain our testing resources. There are over 160 locations throughout the county, and many of these sites are open 7 days a week. We have vaccinated over 941,000 people in Palm Beach County, which represents 72% of our 12-year and older population. We need to continue encouraging people to get vaccinated while we wear our masks, wash our hands, and watch our distance.